This is the tibia. Now be careful of the pronunciation and spelling so you don't mix it up with the other bone that's also found in your lower leg. So the tibia is the larger and the stronger of the two bones. The other bone that we're not looking at quite yet is the fibula, also in the lower leg. But be careful not to combine those two terms. This is the tibia. Currently, we're looking at an anterior view, so the front and side. This is the proximal end, basically what makes your knee joint. This is the distal end down here. So our first landmark you can see from this anterior view is this tibial tuberosity. Now what I'm going to do is I'm going to change this up a little bit and give you a little better zoom into it. Now that we've reset our view, we're still looking at the anterior view here. This is the proximal side of the bone. This is our tibial tuberosity. If I kind of rotate a little bit, you'll see how it's protruding out. There's a bump here. It's rough. That tibial tuberosity is for muscular attachment. Your quadriceps, think your upper thigh. The quadriceps will come and the muscles will insert all the way down here to the tibial tuberosity. If you end up kneeling on the ground, that's the hard part of your knee that's touching the ground. Tibial tuberosity. Now if I tilt this up a little bit, you'll notice how it's smooth up here. Those smooth portions on the very top or proximal end of the bone, those are the condyles. This is the lateral condyle on this side, and over here is the medial condyle. So this is the medial condyle. Now you're saying, well, how do you know which one's lateral and medial? The medial condyle is on the same side as the medial malleolus. So let me reset the view so I can give that perspective. Now that we've reset, we're still looking at the anterior surface here. This up top here, so if we go and come up top, this is the medial condyle. The reason we can know that is this protrusion down here at the distal end. So if we're all the way down the distal end, this protrusion is going to be your medial malleolus. So the medial malleolus tells you which side of the bone you're on. Medial malleolus means this up here is the medial condyle. So let's zoom into this distal end down here for a second. Now that we've zoomed in down here, you can see a little more about how this is the medial malleolus. It's a protrusion coming off the edge of the bone and kind of sticking down a little bit. The medial malleolus, all right here. Now, if you go down to your ankle, that bump of bone on the inside of your ankle on the medial portion, that's the medial malleolus. So this medial malleolus is the medial or inside portion of your ankle. Which leaves us one more thing to look at, the line for soleus. But to do that, we need to reset. Now that we've reset, I've actually changed the lighting also because it's a little easier to see the line for soleus. With a little less lighting, you see there's this indent kind of right here coming down. This is the line for soleus coming down. The line for soleus. It's on the posterior side of the tibia. And it's closer to the proximal end than it is the distal end. The line for soleus. So if I bring the lights back up, see it kind of makes it a little harder to see, but you can kind of see a little bit right there still. Line for soleus. All right, so now we have this posterior view. Let's go back to the anterior view. Now that we're back to an anterior view, again, this is the tibial tuberosity. Up top here, you can see if I come bring around here, this is the actual medial condyle, and this one follow around is the lateral condyle, both on the very top. We know which side's medial because we have the medial malleolus down here at the distal end. So we need to figure out, is this a right or a left tibia? Well, if we know this is the medial malleolus right here, this is going to be a left tibia. Tibial tuberosity is anterior. Medial malleolus is medial. That means this is going to be a left tibia. So that is the tibia and some landmarks.